a central question that we first must ask ourselves before we delve into this. And that's a question that we probably have asked ourselves before now. And that question is that genomics is actually transforming medicine, yes, but who is actually benefiting from this revolution of genomics that we've been seeing over the years? Over 6,500 clinical studies involving human genomic technologies have been registered globally in the past 3 decades. Now, the growth has been really explosive, but how about the distribution of these studies? Yes, your guesses are just right. Very uneven. The focus, Nko, very narrow. How about the inclusion? Having every age group, for example, that is very incomplete, unfortunately. So today, we're going to be unpacking every section of this genomic report very carefully and analytically. And we'll explore what it means for global health, for equity, and for the entire precision medicine landscape. To understand this report very, very carefully, we will basically start by revisiting the foundation of genomics, of modern genomics, which is the completion of the Human Genomics Project in 2003, which was, like I mentioned earlier, very foundational in ensuring that we have the modern genomics that we have today. And it provided the blueprint for human genomics. What followed was, of course, technological acceleration, like we know, in areas such as sequencing, where we have next generation sequencing technology. We now have genome-wide association studies. We have the CRISPR-based gene editing. We have rapid decline in sequencing cost, which is one of the most significant parts of all of this. Sequencing basically moved from being a billion-dollar enterprise to something that we can put into our laboratories and even our clinical laboratories. So before we proceed, let me say something that is very important that we understand. This report is not like an encompassing thing that takes all genomics studies, all genomics clinical studies. No, it doesn't encompass all genomics clinical studies. What it basically encompasses, it defines as human genomic data that is guided by disease detection, classification, treatment selections, therapeutic development, pharmacogenomics, gene therapies, and precision diagnostics. So the report basically defines genomic clinical studies as those using human data to guide disease detection, classification, treatment selection, therapeutic development, pharmacogenomics, gene therapies, and precision diagnostics. So very, very importantly, you should know right now that the report does not include pathogen genomics, which is a very, very diverse area on its own. So it does not include pathogen genomics, strictly on the human. Now, the tension is that technologies became accessible, yes, but access to research capacity did not expand equally across the globe, which is one thing that the report basically highlights the most. The report basically exists to kind of see how to quantify this imbalance that basically exists in this research landscape. So what did the World Health Organization do in this report? They basically analyzed over 6,500 clinical studies registered between 1990 and 2024, like I mentioned earlier, through the International Clinical Trial Registry. Now, this is very important because there are a lot of registries out there. However, the International Clinical Trial Registry platform, which is the one that the World Health Organization took this data from, is basically the one that provides a snapshot because it aggregates the trials or the registries, the trials that has been registered in other national and regional registries. For example, the clinicaltrial.gov in the United States, it's this registry basically aggregates or curates registered clinical studies from that registry. So it also includes registry in Europe, in China, and other top places in the world where this research is actually going on. So that's why this International Clinical Trial Registry platform is kind of like a one that can speak very, very loudly on this subject, because it basically curates, like I said earlier, information from these other registries. Now let's move on. The report basically examined growth over time, which is one thing that it did. It looked at how genomic research has grown from the 1990 to 2024. And at different sections, it talks about, okay, what could be responsible for this increase that we are seeing. For example, from 2010, we saw a massive increase. 2010 to 2012, we saw a massive increase. I'm going to show us the report very shortly. I'll do that. Then we have disease-focused distribution. That's another area that the report basically looks at. It looks at what diseases are being studied. And like we would see later, you see that a lot of communicable diseases are not put into consideration, or a lot of these studies do not really target them. The most common targeted diseases are cancer and other such rare diseases. Cancer and other rare diseases, right? So that is one thing that the report also tells us. We'll see that as we move forward. Then there's also the geographic concentration. Now, the report also shows that a lot of these studies are concentrated in high-income countries, right? The United States of America, a lot of European countries. And that's one thing that the report basically details. It shows that in Europe, the research has been kind of like evenly distributed compared to what we have in the Americas. In the Americas, the research has been largely from the United States of America. Okay, so that is also something that we're going to be seeing as we move forward. Then it also shows which World Health Organization regions are participating in this research. So like I mentioned earlier, the Western Hemisphere, they're doing very well. If you have to compare that to the World Health Organization Afro region, which is Africa, that is, in fact, we're contributed very, very low amount to the studies that have been done. And then another thing is the income group disparities. So it shows us which groups are being studied and which groups are not being studied, right? It shows us the age and sex inclusion. It shows us that the elderly, the younger ones, which are pediatrics, and those younger people are not really included in the studies. A very small percentage of them are included in all of these clinical studies that we analyzed. And then it also shows us the inclusion in sex, that's male versus female. And on that end, it seems to be a bit fairly distributed. And then it shows the equity gap, which is, I think, one of the most important parts of the report. It shows that, okay, we actually do not have so much of these research focusing on the diseases that are even more of global health needs. So diseases that have more of global health concerns are not even being focused on. So which is something that I think that the report basically targets and talks about. Now, one thing that I think that is probably the most useful in the whole of the research is not just simply describe things. The question, is genomic research in alignment with global health need, which is what I just mentioned now? Is genomic research that has been going on over the years, is it in alignment with global health need? And unfortunately, the answer is no. Of course, you should know that by now from what we've explained so far. However, what I think that we are making substantial, after the COVID-19 pandemic, a lot of things happened, a lot of things changed. The way we do things in the world changed. And one thing that still saw so much increase is the research we do in clinical genomics. That's one area that really saw a lot of research coming into it. And now I'm going to be going straight to showing us the reports, right? We're going to be taking the report section by section, and I'll be showing us the graphs and all of those things that were analyzed in the research. So I'm going to be sharing my screen now for us to see. So I certainly believe that a lot of us have so much that we can gain from this report. And that's something that I've always told us about. There's so much to learn from this report. There's so much to gain from it, because it is something that basically tells us and shows us a lot of things about how research has been over the years in this field, and where we can actually just get into, right? It shows us that area where you can easily just get into and be able to make some names for yourself. Yes, I'll say that. So I'm going to be sharing my screen now, and I'll be showing us the report in detail. Okay. So I don't know if we can see my screen. Can we see my slide yet? Can we see my screen? Okay, so I'm currently showing us the report. So what you can see on the screen is the report, the World Health Organization Genomics Report 2025. Now, these are the key messages in the report, right? The key messages in the report basically tells us that, okay, human genomics data used in clinical studies is accelerating, of course, which is something we've talked about earlier. I'm going to take us to this graph, which is something that I think speaks even louder and clearer. That will speak even louder and clearer to us. Now, this is a representation of the number of genomic clinical studies registered annually from between 1990 to 2024. And if you see, you see that from 2004, 2005, you see like there is like a jump. We're seeing a very huge increase from 25 studies in the entire year to 101 studies. And we mentioned something that took place here earlier when we were introducing this. And we said it was the Human Genome Project, right? The Human Genome Project, which was done in 2003, basically helped us to gain more insight. And after that project, we had acceleration in technologies. We had next generation sequencing, we had cheaper sequencing cost, and all of those. So that's really, really was impactful in saying or determining what happened between 2004 and 2005. And then another place we want to look at is 2012, right? 2012, there seemed to be a decline from 2012 to 2013, and then gradually we started having it going up until 2020, right? When the pandemic came, and then we saw some decrease, and then again in 2024. Now, this one basically shows the number of studies. Again, like I mentioned earlier, we must understand that this data is coming from the ICTROP, which is the World Health Organization's International Clinical Trial Registry platform. It is not a complete or an all-encompassing report, because we have pharmaceutical companies that do clinical studies in genomics, private pharmaceutical companies. We have hospitals or private hospitals or even national hospitals which are not of which data are not captured here. So you have to understand that this data is from the World Health Organization International Clinical Trial Registry platform. However, it is representative enough because, like I mentioned earlier, it encompasses or it curates or it aggregates the clinical studies that have been registered in top clinical registers or registries in the world, like the clinical trials clinicaltrials.gov in the United States. There's also the European registry. There is the China registry, right? So these major registries in the world are aggregated into the World Health Organization International Clinical Trial Registry platform. Okay, so the next thing I want us to look at, to pay very close attention to, is the clinical research concentration in high income countries. Okay, if you look at this graph here, this graph that I have here, it basically shows us which countries have been participating in this research over the years. So the top 10 countries by total number of studies over the years, right? So you can see here that the United States of America has been very, very, very instrumental to the success of clinical trials in genomics over the years. They've been very instrumental in to that. From 2004, there's been like a rise, and there's been fairly kind of like a fairly steady amount of research that has been done per year over time from that 2005, 2006, right? Up until, of course, the pandemic, we saw the decline from around 2017, and then a rise again, and then a decline, and the sharp rising again. But see something here, 2016, around 2016, 2017, China basically took off, and they've just been going and going and going. So you see that these countries have been very, very instrumental to the rise and the development of this field, the clinical trials that have been done over the years. But you will see that the number of studies that have been done by the United States, which is the country that represents the most of the, the Americas as a region. The United States is the country that basically represents that region. The number of studies they've done over the years has been a lot, even though we have China rising from around 2015, around 2014, and then in just a few years, they've been able to do a lot of research, but we still have the majority of the research being from the Americas, specifically from the United States. Okay, you can see that Africa is probably nowhere to be found here. In fact, we don't have Africa as part of the top 10 countries that are contributing to this. And we can see them here: China, the United States, Italy, India. That's really nice, because India, according to the World Health Organization, according to the UN classification, India is still classified as a low and middle income country. It's still classified as a middle income country. So that's really nice to see India here. We have Germany, France, Spain, United Kingdom, Japan, Canada, the Netherlands. Okay, so this is something for us to see. And then here we have this geographic distribution of genomic clinical studies. Now, if you look at this map, let me make it a bit larger. Okay, if you look here, you see that the countries that have really done so much, like I mentioned earlier, is the United States. You look here, the United States. You can see that here. Canada has done has made some very huge success as well. But if you look at these other parts, the majority of the white patches we see, which is basically countries that have done nothing, or regions that have done nothing, you will see them being majority coming from Africa. You see the white patches, and okay, Nigeria has been able to do some things, and we're going to see that later. The countries in these low and middle income regions that have been at least contributing some research, some number of research in the entire 6,500 studies. I think Nigeria contributed just 14, about 14 or 17. We're going to be seeing that later. Yeah, here we have it. So you can see the countries that have basically contributed from LMICs, there are just 4 of them. India taking the lead, which was the only country that even appeared in the top 10 countries. India, 235 research. Then we have Egypt, which is in Africa. We have South Africa, 17 studies, and we have Nigeria, 14 studies. And you will not be surprised, of course, that majority of these studies are not actually studies that are taking place here in those countries or happening in those countries. They're probably just collecting samples from those countries, or those countries are just collaborating, but those research are not actually done or led by researchers in those countries. That's another thing that we must take note of. And then we move to the next part here, which is something that I think is very representative. So we can see the distribution according to the World Health Organization, region, and World Bank income group, right? So we have the first, which is World Health Organization region. We have the Western Pacific region, which has contributed 2,006 of those 6,500 studies that were analyzed, right? And then that's contributing to 30.4%. And then we have the Americas contributing 2,043, rounding off to 31%. And we have Europe contributing 1,937, making still approximately 30%. And then we come here, we have Southeast Asia. Now, you see that, if you look here, you see that the graph we saw earlier, this one we saw earlier, which you see like a very sharp rise for China between 2014 and 2019. You see the sharp rise. So if you're not very careful, you may want to look at it and say, oh, China has been doing a lot. China has done a lot. Yes, they have done a lot very recently. You must know that it's very recently that they're getting into the space, and they're contributing massively to it. So you can see here already that this classification or this distribution shows us the parts of the world that has contributed very much to these studies. And then we have the Eastern Mediterranean contributing just 241 studies, which of course is a very huge contribution. Then we have Africa, just 65 studies, and that's making 1% of the entire studies, right? Just 1% of the entire studies. Now, if we look to the World Bank income group, according to this World Bank income group, you will see even greater disparity, right? We see even greater disparity, with 67.5% of these studies coming from high income countries. Like we have 4,266 being from this high income country, and then the upper middle income countries taking another 24.4% of these studies, and low middle income countries, which is where Nigeria falls in, and so many other countries fall in. We have 493, making 7.8%. And why is this a concern? It's a concern because the most of these diseases, and especially communicable diseases that are diseases of global concern, are from these regions, right? These regions, low middle income countries, low income countries, and to some extent, upper middle income countries, right? So this is something that is of great concern. And like we mentioned during the last session that we had on this, it is also a huge opportunity for you as a researcher, as someone who is thinking of going into research in the area of genomics. It is a huge opportunity for you. I don't know if all of us on this chat, all of us on this session, were in the session, the live session that we had with Professor Segun Fatuma from Queen Mary's University, London. During that session we had with Professor Fatuma, he mentioned a lot of efforts that is being put in place to ensure that they build capacity, one, and to ensure that they are able to train more persons in the area of genomics research, right? in areas such as bioinformatics, pharmacogenomics, and precision medicine as a whole. So it is huge opportunity for you. And another thing he mentioned that day was the fact that there are grant opportunities for persons who want to go into these areas. And I'm saying that to you now, you watching this live session now, you certainly should look at this area and see if it is something that you want to go into. Because with this kind of challenges that we have comes opportunities, right? And another thing that we want to look at here, which is what I mentioned earlier, is what areas have this research been done, been carried out the most? If you look at it here, you see that targeted treatment, whether you're looking at cancer therapy, is the one that has taken the most of the studies in low middle income countries. So those studies that we have happening in low middle income countries, low and middle income countries, 93 of those studies were in the area of targeted treatments, and 74 of those studies are in screening and diagnosis. And then we have 46 of them being in pharmacogenomics and very few studies in gene therapies. So you can already see that, okay, these are the areas that I think I could go into, or these are the areas that still need a lot of people to go into. So if you're thinking of going into these areas, you are making, I think, the right decision. And the earlier you start to build your capacity in these areas, I think the better for all of us. Okay, this is another area, which is something I spoke about earlier, that cancer and rare diseases account for most genomic studies. But global health priorities, like I said, remains underrepresented. So we see that cancer and rare diseases together make up more than half of the genomic studies, more than half of the genomic studies. At the same time, we have genomic technologies offering a unique opportunity for us to explore variability in disease expression and treatment responses. So if you're watching this now, you probably want to start thinking of how do I use genomic technologies to explore variability in disease expression, especially in areas that have not been studied, in areas such as communicable diseases. I'm going to show us that very soon. There's a graph that shows that. Okay, so we also have that conditions such as tuberculosis. This is very important. Tuberculosis, which is something that I just mentioned earlier, communicable diseases. Tuberculosis, HIV, and malaria, they continue to be, yes, very major health priorities, especially in low resource settings. However, these genomic studies that have been happening from 1990 to 2024 basically has, to a large extent, not paid attention to these areas. Okay? It has not paid enough attention to these areas. And like I mentioned earlier, that is where you come in. That is where you can come in. Okay, let's see this distribution here. Let's see this distribution of how the disease categories are being represented in the genomics clinical studies that have been happening over the years, right? So you see that a lot of these studies, see, this part that we have here is non-communicable diseases. So we have malignant neoplasm, other neoplasms, neuropsychiatric condition, cardiovascular diseases, endocrine blood immune diseases, diabetes mellitus, digestive diseases, infectious diseases, parasitic diseases, genitourinary diseases, health-related diseases, respiratory diseases, congenital abnormalities, musculoskeletal diseases, skin diseases, and some other diseases that are unspecified. But all of these make up non-communicable diseases. And we can see that it takes up a huge chunk of all of the studies or all of the diseases that has been studied so far, all of the clinical genomics research that has been happening so far. And you now look here, you see the communicable diseases that has been studied. You see that, let me rotate this. You see that studies such as infectious diseases, parasitic diseases, and then we have endocrine diseases, blood diseases, immune diseases, nutritional deficiencies, HIV, tuberculosis, and all of those sort of diseases have not been studied adequately. And you probably will be asking yourself, why do we have some diseases as classified both as communicable and non-communicable diseases? Yes, we could have some infectious diseases we could have some communicable diseases that have, or non-communicable diseases rather, that are of some diseases that are of multiple etiologies, right? They could be communicable and non-communicable diseases. For example, some endocrine diseases could be infectious, right? Could be carried by some organisms that can be transferred from one person to another. We also have some endocrine conditions that are not like that, that are non-communicable. So that's why we have them appearing in the two classes. We also have digestive diseases as part of the communicable diseases, right? Some digestive diseases. So this distribution is something that tells us a lot about how this research has been going on over the years. Like I said, this huge chunk non-communicable diseases. And we have just this small part for communicable diseases. So these other parts are not even part of it. The parts showed in green and blue. So there's so much that we can do in this field, right? Now, this is the next part that there's a huge research gap. Perhaps the research gap is very difficult to bridge, of course, because this part is basically about the age groups. So most of the studies involved adult cohorts with a limited representation of children and older adults. So you see that a lot of these studies do not really include children or the elderly. And what that does, the implication of that is that it makes precision medicine not precision medicine for everyone. So it basically limits the advantage that we could get with precision medicine. It limits the scope or the usability, if you like, of precision medicine. That is something that we certainly would not want to happen. That's something that, of course, precision medicine should be for all. It should be a representation of all, right? So what we want to do is, like I mentioned earlier, want to get into these areas and see how to fill these gaps. And with filling these gaps comes opportunities, like I mentioned earlier. So you can see that over 75% of these studies included adults aged 18 to 64 years. And we have only 4.6% explicitly focusing on pediatrics population, with only 1% solely for children. That is huge, huge disparity there. And then we have only individuals aged 65 and above appearing in only 3.3% of the studies. That is a lot. That is a lot, right? A lot disparity. So what it does, like I mentioned earlier, it basically restricts or confines or if you like, limits the reach of precision medicine. And like I put here, like research gap, like a very huge research gap, of course. So we can get into this field and fill these gaps. Okay, so let's see another thing, which I think there's even distribution, right? In the gender aspect, we have fairly even distribution, right? So we have these are studies that include both male and female. You can see the ones that we have on top here. That's a lot of them, and that makes up 78.6% of the entire studies. That includes both male and female, and we have just 10% of them being just for females and 4.8% being for males, right? Alone, right? And then we also have this other part here that is unknown. Of course, this is as a result of perhaps the studies not explicitly saying which populations it is studying and all of those sort of things. So one thing that should speak to us in this report, that should speak to us in the most in the most critical ways is that without precision or genomics research being something that is globally and evenly distributed, the reach of precision medicine is going to be limited. It's going to be for a selected few. So if we have advancements in precision medicine, it's probably going to be mostly for people in these high income countries. And if you were in the last session we had, no, the penultimate session we had at Pharmagenosphere and in the webinar series that we're currently having, that is ongoing, you probably would have heard Professor Shegun when he mentioned that they did a study in Africa and they took samples from a country in Africa. And when they took the findings from that country and took it to another country, South Africa, from Uganda, South Africa, they found that the data they got were not fitting into, or the polygenic risk score machine that they had developed were not fitting well or giving desirable results in that population in the same Africa. So you can see there is so much diversity that every single country, every single region has to be captured. We have to be able to genotype, sequence, and get information from every single region, every single group, to be able to get a complete representation of all. And that is when precision medicine is going to be precision medicine for everyone. Okay, so that is basically the end of this report. That's the end of this report, and it goes on to give citations and acknowledgements and all of those sort of things. So it is very important that we see these opportunities and we try to make the most of it, right? And one thing that I believe that one way that I believe that we could do this very effectively, like I mentioned earlier, is to build capacity. To build capacity. And how do you build capacity? You build capacity by working on yourself, by ensuring that you partake in conferences, you partake in even webinar sessions like we're having right now at Pharmagenosphere. We've had, I think, 4 sessions currently. We've had 4 sessions and we still have 5 sessions to go, right? So there's still a lot that you could learn from the webinar series that we are currently having at Pharmagenosphere. So if you at any point think that this is an area that you want to go into, this is an area that you would like to go into, you are very welcome to join us at these webinar sessions. And you'll be able to get ideas about how best to go into these areas, at least from our speakers, our guest lecturers, who are very, very renowned and globally acclaimed researchers and professionals and experts in this field. So one thing that we've been able to do over the years is that we've been able to connect interested persons to these experts that come to our webinar series, that come to speak at our webinar sessions. And one thing that I've found over the years is that they are very generous and they want to help, but a lot of persons are not even seeing these things. A lot of persons are not even ready to want to make that move. For the very few persons who have been able to make the move to say, okay, let me reach out and see how I could maybe do an internship under this person, there's been success over the years. So if you're that person listening to this now, you certainly can be part of it. Certainly can jump into our webinar series. Even if you've never attended any of the sessions before now, we have 5 sessions to go. You can still learn a lot and still get to connect with a lot of persons. So in conclusion, the report basically provides a 34-year snapshot of genomic clinical research over the years. And it shows the extraordinary technological acceleration, the clear clinical integration in oncology and rare diseases, and it shows the significant global inequalities as well as the narrow prioritization. Genomics has the potential to transform diagnosis, prevention, and treatment of diseases. But the transformative power depends on inclusivity. Like we mentioned earlier, it depends on inclusivity. The next decade will determine whether genomics become a globally equitable tool or a technology that widens the health disparities that we have. So what happens between now and 10 years, perhaps, would play a major role in determining whether genomics becomes that tool that helps us to bridge all of these gaps in our health disparities, or it widens the gap even more. The foundation has been laid. The question is whether global strategy will match technological momentum. Now, if you are new to this channel, you've not been with us before now, would really appreciate it that you subscribe to the channel, you double check. Sometimes some persons think they've subscribed and they just haven't subscribed. So you want to double check to see that you've subscribed to the channel, you like this video, and you turn on the bell icon so that whenever we drop any videos in the future, you would be notified. And in fact, we stream all of our sessions to YouTube, so you can also be notified whenever we drop this live stream so that you can certainly be part of it. For those of us who are here right now, who are watching right now, I would like to know what we think. Just before we end this session now, what we think about these reports. Do you think it is something that is a representative of the whole, or do you think it is something that doesn't really represent the whole? I explained that part earlier, but I want to get what you think about it. And if you have any questions whatsoever, please feel free to drop them in the chat box right away, and we'll take the questions before we close now. If you have any questions, feel free to drop them in the chat box now. Okay, I see amazing people here. Abraham has been with us. I see Abraham. I see Faith Omini from Nigeria. It's great to have you here. I see Yahaya Umar. Thank you so much for joining. I see Amudal. Thank you so much for joining. Okay, no, there's no attendance tonight, Amuda. There's no attendance tonight. Thank you. The session has been fabulous. Thank you so much. I see Ayman Begon. Thank you so much. I see Chiamaka Gloria from Nigeria. Thank you so much. So if we have any questions, this is the time to drop it. And like I mentioned earlier, what do we think about this report? And there's something you are thinking in your head right now of how you could get into this space, and you do not know how you could get into it. Please just say it here. You can drop anything in the chat box, in the comment section, and we will talk about it. I would address those concerns here right away. Yes, I certainly agree with you, Amudal. I'm not sure if I'm pronouncing that correctly. Amudal Smile. I certainly agree with you. Africa needs to top up its game, right? And when I say Africa needs to top up its game, I'm not talking to the person who is already 70 years old or 90 years old or even 60 years old. I'm talking to the youth, right? Perhaps a good number of us who are on this session today, I believe majority of us on this session today from the chat box now, I can see, are from these low and middle income countries. So there is a role that you have to play in all of this. There is a role that you have to play. And part of playing that role is building yourself, building capacity. Like Professor Fatuma said during his session, building capacity. And he mentioned that day that there's a lot of opportunities to get into those cohorts to build yourself. I'm not certain if any one of us has been able to connect with him on LinkedIn. If you've not done so, you are not doing yourself any good if you've not connected with him on LinkedIn to get these updates when he drops them. It is very important. If you've not done that, please, as soon as we end this, go and connect with him on LinkedIn. It's someone you should follow. It's probably the biggest voice in Africa as far as precision medicine is concerned. Okay. Exactly. I cannot agree with you more, Abraham. I cannot agree with you more. Africa has a huge research gap in genomics, and that is where opportunities actually lies. So there is so much opportunities here. Okay, I see another one from Amuda Smile saying how to get started in pharmacogenomics, ranging from where to specialize to mentorship. Yes, this is one question that I get asked a lot of time. And the answer that I provide is simple. Where do you start from? You can start with small studies in your region. For example, I'm still an undergraduate student in pharmacy school, and I know that in my university here, we do not have gene sequencing facilities. We do not have facilities that would enable me to sequence gene or do those complex pharmacogenomics research. So what do? I started with the very basic of things, reviews. So you can do reviews. You can do pharmacogenomic reviews, right? I've done a review on pharmacogenomics of anti-malaria in Nigeria, for example. I did a review on pharmacogenomics of anti-malaria in Nigeria, just to look at the different genetic variants that has been studied in the Nigerian population and how these genetic variants, at least in the global space, how they've affected anti-malaria therapy. Malaria is is one of the diseases that Nigeria is top of the world. So you can see why I decided to do malaria, right? Malaria is a disease that in the whole world, Nigeria is the capital of malaria, right? So it is a disease that is very, 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 very important to Nigeria. And so I just looked at the pharmacogenomics of those genetic variants that has already been classified. There's been a lot of studies that has been done in Nigeria actually to basically identify some of these variants. But I believe that if you decide to go into that area today and do some more sequencing, you'll be able to identify even more novel variants that has not been identified before. Yes, but something has been done, at least in the area of malaria. You can look at, you can ask yourself the question, what genes or what enzymes are responsible for metabolism of this class of drug? Let's take cardiovascular drugs, for example. Drugs for hypertension, the ACEIs, the ARBs, the calcium channel blockers. You can take those drug class, for example, and ask yourself, what enzymes are responsible for metabolizing these drugs? A lot of the times you would come to CYP3A4, which is an enzyme that basically metabolizes a lot of drugs, CYP3A4 and CYP3A5. You will see CYP2D6, CYP2C19. Now these are very common genes that codes for these enzymes that metabolizes these drugs. And when you start asking yourself that question, you will now think of linking it to the medications. So if I have CYP3A4 or CYP3A5 or CYP2D6 metabolizing a lot of cardiovascular drugs, can I not just look at the CYP3A4 variants that are in the Nigerian population, for example, or in the Kenyan population, the variant that has been identified in the Kenyan population? You will now look at those variants, which of them are representing presenting with poor metabolizer status, which of them are presenting with ultra rapid metabolizer status, which of them are making the patient normal metabolizers. So when you now see those ones that are poor metabolizers, rapid metabolizers, ultra rapid metabolizers, you now begin to see, okay, this is likely going to be the impact of these variants on these drugs when they are administered to this population. You've been able to do something. That is a lot, because you've been able to at least put some studies that have been done together to see, okay, this is what has been done. We have some variants that has been classified, that has been identified. Now, how do I, let me see if these variants that has been classified, if they have effect or impact on the metabolism of these drugs. And of course, if they have effect on the metabolism of the drugs, they will certainly have effect on the outcome, the therapeutic outcome. Because if they are affecting the pharmacokinetics or the pharmacodynamics of the drugs, they're going to be affecting the end effect that you get for that drug. Which, if they are, for example, they are poor metabolizers, you have a lot of poor metabolizer variants in your population, you're going to be having a situation where the drugs are not being metabolized enough. So you probably have the drug being building up in the body and causing toxicity to the persons that are taking the drug. Or you would have, let's say you have ultra rapid metabolizers. The drugs are being metabolized too fast. So at the end of the day, you will not be able to get the needed therapeutic effect or benefit that the patient is supposed to derive from that drug. And at the end of the day, there is therapeutic failure and there is increased cost on our entire healthcare system, which is one area you can easily work on. Another area is the adverse effect it causes and all of those sort of things. But that is just another area that we can also look at. So you do not have to start very big, right? Amudal, you do not have to start very big. You can start with these small areas. You can try to know the knowledge, attitude, and perception, for example, of people in your country or people in your university or the medical students in your universities, including the pharmacy students, the medical students, the nursing students, the biochemistry students, and so on. You can try to get their knowledge, attitude, and perception about pharmacogenomics or precision medicine to kind of like know what they think or what they know about it, the level of their knowledge, what they perceive about it, and how they think, how important they think it is to the healthcare space generally. So these small studies is basically what the bigger studies that will come later would build on. So you certainly can do things like that. I don't know if that answers your question. Amudal smile. Yeah, so much opportunity to tap. So much opportunity to tap. Salami. Olufumi Salami. There's so much opportunity. Thank you, Ayma. Thank you so much, Ayma Begon. Thank you so much. Okay. Jackson says Nigeria needs to be more proactive as well as Africa to update themselves and take part in this genomics because so much opportunities are in here. But how do we get started? Okay, I just talked about that now. I think the part I talked about earlier should have answered your question. How do we get started? Like I said, you can start from the very basic things, the very small things, right? It doesn't have to be the big studies, right? These small studies that you do will basically pave the way for the bigger studies. For example, if you're able to do this knowledge, attitude, and perception studies, you publish it, you can always refer people to that. If you're applying for grants, for example, the grant bodies will want to see what you've done before then. They would want to see it, even though they don't want to see it, even though they will not want to see it. If you present it to them, it will show them that, oh, you're actually serious, you actually mean business, right? So there's always the place of starting small. You can certainly start small. And by starting small, you open the gate of bigger opportunities for yourself. So I don't know if any one of us have any other questions. I think I've taken all of the questions in the chat box. Yeah, I have. I've taken all of the questions in the chat box. So that is it today for the session today, guys. It's been an amazing time with all of you, and I really appreciate this. I really enjoyed this session with all of us, and I'm hoping that we'll continue to do more like this. We'll continue to have more sessions like this where we can talk about these opportunities on an even larger scale, invite even more persons to talk to us about these opportunities. Um, I'll probably try to um, get Professor Shegun Fatuma to join us on one of our sessions in the future to talk more about these opportunities, because he gave us kind of like a snapshot into what is possible during the session he had with us. I would certainly try as much as possible to make that effort to bring him to one of our sessions again, specifically talking about these opportunities and how we can fit into them. Okay, so that's going to be our session for today, guys. Thank you so much for joining. Again, if you love what we do here, if you got value, please do well to subscribe to the channel, do well to like the video, and we've made several other videos on the channel about other things as well, especially in the area of genomics, pharmacogenomics, precision medicine. You want to also take a look at those as well. And I did some very small shots on this World Health Organization genomic report. If you check the YouTube channel, you'll find them on the YouTube channel. Just some shots. I did, I think, over five series, part one, part two, three, four, five, where I basically went into details to explain the different opportunities, the different kind of research you can get into for that this report shows us that you can get into. I went into that on those videos. You can also check those out. So once again, guys, that's going to be our video for today. Thank you so much for joining us. We really appreciate the time that you took to be here. Good night, everyone. Good night. Good night, everyone. And just before I end the call, for those of us who have registered for the session, the precision medicine session we're having, do not forget that our next session, which is going to be very practical, we're going to be looking at a lot of cases. We're going to be navigating a lot of pharmacogenomics resources with Nicole from South Africa. That session is going to be happening on the 24th. On the 24th. You do not want to miss that. And very importantly, we are collaborating with Clinical Pharmacists Association of Nigeria, Edo State chapter, to continue the sessions. So for the rest of the sessions in the series, we're going to be collaborating with Clinical Pharmacists Association of Nigeria, Edo State chapter, to bring you even more value in all of the sessions that we're going to be having. So once again, good night, everyone.